Hello and welcome to Agents of Tech, where we explore the minds of the greatest innovators addressing the world's critical science and technology challenges. I'm Stephen Horn.
And I'm Autria Godfrey. Happy to have you with us, and today we are looking at mental health and technology. Welcome back to Agents of Tech, everyone. I'm Autria Godfrey, and I am coming to you from our nation's capital in Washington, D.C., right on the Virginia line. And my co-host, Stephen, is across the pond in London. Hey, Stephen.
How are you today, Autria?
I am great. Thank you for asking. Today we are talking about something that is ubiquitous, technology. It is in everyone's hand. It's sitting in everyone's lap. It's on everyone's desk. Consumers are using technology in nearly every aspect of life. And according to the Pew Research Center, 95% of U.S. teens use a smartphone, so almost all, and 45% of those users say that they are online almost constantly. Stephen, quick question to you. How much do you use some sort of digital device?
I guess I use a digital device all the time, right? If I'm not actually on my phone, I've got my smartwatch on, or but virtually all the time. And I was at the American Psychiatric Association conference in New York, and they were talking about addiction. There's a real sort of two-way tussle here between those people who say, yeah, no, digital, where would it be without it, and others that say, we're going to hell in the handbasket.
I think you're exactly right. And for grown adults and people in the workforce, obviously it's now a necessity. You can't be unplugged really and be successful in your career, but should we be applying the same parameters when it comes to children? I mean, as the use of technology becomes ever more pervasive, some are questioning the link between technology and mental health, specifically with regard to children and young adults.
Right, and the US Surgeon General, Vivek Murthy, said that, this is in a New York Times op-ed piece, I think, that sort of said that, this is virtually a mental health pandemic that we're facing.
Right. In fact, he went so far as to say that social media should come with a warning label, akin to the ones that appear on cigarette packs. Now, of course, that would require congressional action, and I don't know if you've heard, Stephen, but Congress likes to take their time over here. So who knows if that's down the road anytime soon. But I do think it's interesting how much of an alarm bell he's ringing when he says, that we are in the midst of a youth mental health crisis. And he says that, parents really need to be involved here. They should not let their kids have social media until after middle school.
As I said, I was at the American Psychiatric Association meeting in New York. Always a great place to pop in and find out, what's happening. And they've been thinking about this for a long time, like I say, and they've, gone for their addiction theme on this. And I spoke to Marc, Potenza, and Sanya Virani from Yale and Indiana University, and they were looking at whether social media is part of that addiction problem. Some of the issues that we're talking about, gambling, pornography, social media, they're all distinct areas. So why are we taking them together?
One may think of these as distinct behaviors, but in many ways they intersect or overlap. So for example, the ways in which gaming and gambling intersect may be with respect to loot boxes or loot crates, which are elements within video games that are gambling-like elements. Similarly with gaming and pornography use and social media and pornography use, the youth, for example, are often introduced to pornography through social media.
Gaming and social media are such large parts of everybody's lives these days. How does one see them as problematic?
They can be problematic in different ways. One way is in excessive engagement, problematic engagement that may be addictive.
Sanya, what does research tell us about the potential long-term implications of pornography on young people?
Yeah, I'm glad you asked because specifically referring to the youth that now lives in an era of the internet and has always grown up in the era of the internet. Online pornography is something that is ubiquitous almost, and variety is the name of the game, right? So having to consume that kind of content online oftentimes leads an individual to experience some sort of sensitization to various stimuli, wanting to have more and more of different things, placing sort of unrealistic expectation on a real human partner in the long term, besides having very obvious overlaps with more and more depression, anxiety, and resorting to all of these mechanisms or these ways of tackling stress in a high stress environment and keeping up with demands of daily life in a very maladaptive way.
We were talking a minute ago about addiction and social media. What are some of the challenges about talking to young people about addiction and social media?
I think that, and especially the country in which we live, and it's specific to the environments in which we function, right? I think that the problem is not being able to sort of decipher when it might lead to excessive use,
Right.
And consume all of one's attention and time.
What about companies themselves? What can companies themselves do to help?
And I think that they can work together with regulators, work together with researchers to make data available so that we can understand the nuances of the impacts of their products on people.
My final question to you both is that a lot of these are fairly new developments. So, what can psychiatrists do?
A first step is asking about the behaviors, asking about the behaviors in a non-judgmental fashion,
Right.
and getting an idea of the extent to which people engage in the behaviors and the extent to which they may be impacting their physical or mental health.
I would just add that clinicians would serve themselves and their practices better by making themselves more acquainted with, these kinds of new, as you defined, addictions, and not to disregard them, and to know their associations with various psychiatric disorders, which we already define.
Right.
If everything is about creating a strict diagnosis, but just to be aware and to know the basic questions to ask as to elicit where these problematic behaviors exist in a clinical space.
So I'm joined again by Layla Rizvi, who's our head of research here at WebsEdge. Welcome.
Thanks for having me again. It's good to be back.
It's great to see. Now, this is a big issue, right? The link between sort of digital health, and we're talking about social media. We're talking about, kind of addiction. Now, you're a different generation to me.
Yep.
So where do you stand on this?
So I think it's difficult to kind of understand the impact of digital technology and separate it completely, because we're in a post-digital age and you can't really differentiate between what is digital and what isn't digital because it's so deeply entwined. And there's obviously huge positive benefits to digital technology. You know, children's parents can see where they are, and in terms of a level of safety, in terms of reducing stress, there's massive positives. But at the same time, social media, young children seeing things which might be promoting self-harm or leading to insecurities, things like that, not so positive. And one of the key pieces of evidence that's given to say that, social media and digital technology is having a negative impact on our youth and their mental well-being is the correlation over the past 10 to 20 years between kind of negative mental health symptoms, which have increased in prevalence amongst youth, and the rise of digital technology. But at the same time, this is a correlation and not necessarily a causation. We don't know how it's happening and what other underlying factors are kind of mixing the picture.
Right. Well, one of the things that was really interesting to me at the APA conference, because they were talking specifically, right, about gaming, gambling, pornography, and social media. So these are pretty serious subjects. And they were saying part of the problem is the interface between all these. So somebody's first experience of gambling, for example, might be in part of an online game. That's what makes this sort of amplifies this problem and makes it quite difficult to kind of understand.
Yeah, and I think there was another study which was done, which was looking at how we actually use social media and like the intent behind it and whether that has a negative or positive impact on well-being. And they did find that when you use social media passively, that results in a negative impact on your well-being. Whereas if you're using it actively, where you're kind of imitating real life social engagement, it doesn't have a net positive impact, but it doesn't have a negative impact either. So,
Interesting.
It is the intention in the way that we're using it ultimately.
And, going back to the addiction component of it, at the basis of addiction is that dopamine hit. So whether you're getting it from gambling, you're getting it from some sort of an artificial, drug use, whatever it be, it's that dopamine. And there have, been studies done that show that we're getting that same dopamine, that quick dopamine hit and that high every time you get that online like, or every time you get that positive comment under a photo that you post. At the basis of addiction, it's hitting all the same bells that, these online gaming, pornography, gambling, you have it, drug addiction, whatever it be. So trying to pull it out and not treat it the same as you would regular addictions is clearly proving to be unsuccessful.
Yeah, absolutely. And I think what's really interesting is that the net negative impact of digitalization is massive in the US and the UK, but not necessarily consistent globally.
Oh, that's interesting.
And so, it feeds into how we, again, utilize our digital technology and what we use it for. Whereas for a lot of people in developing countries, it's a huge upgrade, as in they're not necessarily, their first interaction with an iPhone might not have been to go on social media and comment on someone's Facebook post, but rather use it, for navigation. And the way that the technology is leveraged, the cultural context it's in, but even in Western Europe compared to the UK, the net negative impact is not as substantial. So, maybe more research needs to be done into that and those differences.
That's encouraging, at least, but I think the fact that we're even talking about this and we're starting to lump, technology addiction in with some of our more standard addictions and the way that we're starting to treat it the same, hopefully we'll see some progress there. Something else, though, that I think is interesting when it comes to digital technology addictions is how it's causing some patients who have never before in their life dealt with symptoms of ADHD to now come to their physicians or their psychiatrists and present with ADHD symptoms. Wendi Waits of Talkiatry is a psychiatrist who is really focusing on this and exploring how all of a sudden she's starting to see some later in life patients presenting with these ADHD symptoms when they never have been before, and she is making the correlation between their digital tech addictions. Take a listen.
There's some evidence to suggest that children, high schoolers, and even adults can acquire ADHD symptoms as a result of overusing their digital technology. We, as a specialty, haven't quite decided if it's possible to acquire ADHD. Clinically, a lot of patients are coming in requesting treatment for inattention, but they don't have the neurodevelopmental history that would be required for a diagnosis of ADHD, and yet they're presenting with symptoms that impair their functioning, typically to the degree that we would want to treat them. So it's become kind of an ethical issue and a bit of a conundrum in our field. Until we define digital technology and define addiction to digital technology, we really can't measure whether or not those things might result in ADHD symptomatology. So that's kind of where the field is headed. This is the first time I've seen a real big focus on behavioral addictions at the APA, and it's really exciting to see that because it's been a big problem in our society and it's something we need to grapple with as a specialty. It's going to take a collective national discipline, quite honestly, to reduce our use of digital technology. The APA can take the lead in trying to advertise and spread the word about the dangers of overusing digital technology, not only to our brain function, our cognitive function, but even to our physical health as well. So I wish I could say I was more optimistic, but I think that we could be leaders in the field if we choose to and hopefully make an impact.
So really fascinating interview with Wendi there, talking, about how all of a sudden she's seeing, some of these young people and again later in life people coming to her saying, I think I'm suffering from anxiety and from depression. And we're starting to connect the dots and say maybe it has a little bit to do with your technology addiction. So what can be done to mitigate the negative effects of digital technology on mental health, specifically on young people? Well, as you heard, our Surgeon General is saying Specifically, young children should not have social media prior to middle school. If you can push it even later than that, even better. I was listening to one researchers talk about how if you can get phones out of the bedrooms of children and young people, that's going to have a significant impact on depression levels. A lot of children who do have these smartphones or smart devices or tablets say that they're not going to bed until between 12 a.m. and 4 a.m. every single night, and their parents have no idea because they're in their bedrooms doing all this scrolling, and so their parents think they're in there sleeping. They're actually scrolling until the early morning hours. They're not getting that very important sleep at that young age. So really parental involvement is a huge component of it, but we're now finally seeing like the American Academy of Pediatrics trying to call on these social media companies to kind of minimize some of the apps that young children can access, or some of the things that they can access through like Instagram or Snapchat. There have been big issues with children being able to access images and things that can create eating disorders or that can perpetuate eating disorders. So they're trying to get, everybody on board here, from the medical community to the people behind these apps and behind social media, to really get on board to try to put up some barriers to what these children and young adults can actually access online. So maybe we're starting to take the right baby steps forward. I hope so. Layla, what do you think?
As it is with any technology which completely revolutionizes society, you need safeguarding in all shapes and forms. So as it was with the car, I mean, that absolutely changed society, but we have seatbelts, we have age limits, we have speed limits, and you need the same, particularly in relation to children as you were talking about, Autria, those safeguarding mechanisms where you limit the age at which you can join certain social media, the times that children can use iPhones, and things like that. And I think if we're looking at mitigating the negative effects, when it comes to adults, I think it's more about intention and using digital technology with more intention and awareness of our behavior.
So I'm going to do a straw poll here amongst three adults. Okay, so which one of you guys is going to? All right, we talked about all the dangers, right, of social media, digital media. Which one of the three of us is going to give up their phone for good now and never use that phone again?
I would, if it would mean I would still keep my job. That's my thing.
So I think part of the problem here, right, is that there's so much, we use all these digital devices, So I've got my watch on, which measures my heartbeat, which measures my number of steps. I've got my phone somewhere near that I can access my bank account. I can send somebody money. I can see where I am. I can see where other people are. I can see how to get to the studio today. I was 20 minutes late, but I can still see how to get to the studio today. So I would say, look, it's very hard to live without them now, right?
Yeah, but it's all about balance. So no one is asking people to get rid of their phones completely, but it's being aware of, why are you using your phone? So 50% of the time when we pick up our phones, no one's messaged or called us. We're addicted to needing to be needed, right? So it's about realizing, okay, how much screen time am I actually, having? How long am I spending on Twitter, on Instagram versus using your Google Maps to get to where you need to? And when people actually realize that is far more than they think it is, then it's a shock to the system, and you can do something about it and think about, okay, when I'm picking my phone up, why am I picking it up? Is it just out of habit? Is it to passively scroll? Is it kind of a soothing mechanism to make me feel better, or is it actually for utility?
Mm-hmm. And I think to Layla's point, there's actually a really big movement, at least here in the United States, among parents of really young children. I mean, we're talking like that 5 to 9 age range, to give their children either the little wearable devices where they can track where they are, or they can send, like a, I made it, I'm okay, or I need help, text message, but there's no actual like online capabilities to it. they're either giving those to their children in lieu of a smartphone, or they are giving flip phones. I don't know, Layla, I think we're talking way before your time here, but flip phones.
I had a flip phone.
You know, those used to be a thing where you could call your parent and say, hey, I made it here safely, or Mom, I need you to come pick me up, you know. But you, again, this was again before your time, but like you couldn't send photos, you couldn't access the internet. So a lot of those detrimental things weren't accessible. So there's a big push here in the United States, at least, to try to like revert back to those very like archaic types of technology. And, you know, I think that you know, knowledge is power, right? The more you know, the better you do. And so I think the fact that we're finally kind of getting on board with, we are subjecting ourselves to a lot of negative things, even as adults, you know, like you go on Instagram or you go on Twitter, and after 30 minutes or 45 minutes, you're like, man, did that help me at all? I think I feel worse about myself, or I feel worse about the state of, you know, the world today. So I think the fact that we're realizing how detrimental social media can be, hopefully is like a great first step to maybe mitigating what we're doing to our minds. So I do want to talk about, in our previous episode, Jesse Ehrenfeld, the president of the American Medical Association, talked about digital health and how AI will not replace doctors. I feel like we've spoken about this at length. However, digital technology does have the potential to transform healthcare. So we spoke to Darlene King of UT Southwestern about the use of AI chatbots to meet these mental health needs.
There are many apps that incorporate conversational agents or chatbots, but not every app is the same and not every chatbot is the same. So if you are looking at utilizing one of these or recommending one for your patient, you need to know what kind you're working with. Is it one that is built off of a specific algorithm decision tree where they ask it a question, it is defined what it's going to say back, versus one that is more open-ended, utilizing generative AI? That is a lot more unpredictable. The evidence right now for the effectiveness of conversational agents isn't a lot. There needs to be more done. There are some apps that have shown that they can provide some CBT in a very prescriptive way using an algorithmic basis. For generative AI, that is still a really heavily active area of research. Some apps will say, you know, we have evidence, but when you go and you look at the actual evidence, it's not as strong as you'd like to see for something that you're using for treatment of a patient. It's really important when you're thinking about utilizing a chatbot to turn to the APA's App Advisor model, because the field changes every day. There's something new that comes out. And if you know how to make informed decisions about technology, you can handle what gets thrown at you. I really want to be optimistic about it because I see a lot of benefit of increasing access, providing something for patients who can benefit in times of crisis. But right now, chatbots aren't that robust with handling crisis situations. We need to really advocate and communicate with developers that are creating these technologies so we can help guide things that will be helpful for patients. I think our voice is really important.
Do you know, I thought that was such an interesting interview with Darlene, didn't you? Because, you know, people keep sort of saying, you know, are we going to have psychiatrists? Are we going to have AI chatbots? And Jesse was kind of saying before, right, that the technology was not going to replace the psychiatrist. But he also said, as Darlene did really, that the psychiatrists need to be involved in the design of the technology, you know, and we kind of live in this kind of fool's paradise of thinking it's an either or, right? Because, you know, we don't have, as Jesse said, we don't have enough psychiatrists. We'll never be able to train enough psychiatrists. So we cannot sort of avoid this, but it's how we get the psychiatrists involved in the design of these products and services, right?
Yeah, absolutely. And there was a paper published by Marc at University in May 2023, so pretty recently, which was evaluating the use of chatbots. And, you know, there were a lot of positives to it and there were some negatives. So like you said, Stephen, it's not one or the other. It's not a binary kind of choice that we have, which a lot of people kind of treat it as if we have to have everything AI or nothing AI. I mean, it can be a combination. It's there to supplement, our existing capabilities. And they found that the positive was that a lot of patients felt that a chatbot was very non-judgmental because it's not a person there to judge you. And that's such an important thing in, psychiatry and people's mental well-being, that they don't feel like you are judging them for their actions, for their feelings, for their emotions. But simultaneously, at the moment, the difficulty is the lack of kind of humanity, customization, and personalization of these chatbots, which you can't get at the moment, but maybe that will eventually come. So it's a balance.
That's really interesting. It's a very interesting aspect to psychiatry because, your treatment is only going to be as successful as your honesty when it comes to psychiatry. So, if you don't feel comfortable truly bearing your soul in front of the person that's supposed to be helping you, then you're probably not going to make as much progress as you potentially could. So it's really interesting that AI brings that level of, I guess, freedom to the field of psychiatry. It'll be interesting to kind of see how it all shakes out as AI gets a little bit more refined and a little bit more, specific. Again, it's all a work in progress, but it gives us something to talk about, doesn't it?
I think it does give us something to talk about. It's a really interesting subject, isn't it? Well, Layla, look, thanks. Thanks again for coming here and telling Autria and I how the world works. We really do appreciate it. So thank you.
Thank you for such an interesting conversation once again.
We're great to see you. So next time, Autria, what are we doing? We're looking at AI in education, right? And bridging computer science and society.
It's going to be a hot topic, and we hope that you'll join us. Please like and subscribe wherever you get your podcasts. Until next time, goodbye. Agents of Tech is brought to you by Web's Edge.